Can you get pregnant while nursing? Yes, it's possible to get pregnant anytime from about 3 weeks after giving birth. This is true even if you're breastfeeding and haven't had a period yet. Many women are less fertile while they're breastfeeding, especially in the early weeks and months. This is because breastfeeding reduces your levels of certain hormones, which are needed for ovulation and pregnancy. The more your baby breastfeeds, the lower your hormone levels will be, and the less likely you are to become pregnant. If your baby is under 6 months and exclusively breastfeeding day and night, your chances of conception are low. Some women actually use breastfeeding as a form of birth control. This is called the lactational amenorrhea method, LAM. It is most likely to help you avoid pregnancy. How soon can you get pregnant after giving birth while breastfeeding? If you're not breastfeeding, you can get pregnant again as soon as 3 weeks after giving birth. However, it is found that most women do not ovulate until 6 weeks after giving birth. This is different if you choose to breastfeed. Unfortunately, it's difficult to know when that first ovulation is going to arrive. You might not know it's happened until you get your first period after pregnancy, by which point you've already been fertile. There are a couple of options available to help you detect ovulation. LH tests can detect a surge in hormones before ovulation, while taking your basal body temperature can confirm ovulation has happened. Do I ovulate while breastfeeding? You're extremely unlikely to ovulate in the first weeks after giving birth, and if you are only feeding your baby breast milk, then ovulation is likely to be delayed further. Of course, if you're not ovulating, then you can't get pregnant. However, since the signs of ovulation are extremely subtle, you likely won't be able to tell when it's coming and prepare for it. Chances of getting pregnant while breastfeeding. If used perfectly, breastfeeding as a birth control can be as much as 98% effective. This means you are only giving your baby breast milk, and only for the first 6 months. After this time, the chances of becoming pregnant will increase. Of course, this varies from woman to woman, and while for some it might take a longer time for ovulation to resume, once it does, there is a risk you might get pregnant. If we look at birth control effectiveness, and take couples who have regular sex without using any protection, there is an 85% chance they will fall pregnant within a year. Again, if you are breastfeeding exclusively, then ovulation is likely to be halted for the first months after giving birth, and you can rely on breastfeeding as contraception during this time. Pregnant while breastfeeding symptoms. The symptoms of early pregnancy can be hard to detect at the best of times, but if you're looking after a little one and you're having irregular cycles, it might be extra hard to detect a pregnancy. However, some symptoms of becoming pregnant while breastfeeding include missed or late period, tiredness, nausea, and sore breasts. The symptoms of early pregnancy are also very similar to those of PMS, so it can be a little confusing, especially if you have been experiencing irregular cycles after giving birth. If you're in doubt, take a pregnancy test and consult with your doctor if you still have concerns. Can you continue breastfeeding while pregnant? There are no hard rules about breastfeeding while pregnant, but ensure you get enough food if you want to do so. You should get enough calories for yourself, the breastfeeding baby, and the developing baby. The breastfeeding baby might start refusing breast milk in the first few months of your pregnancy. This can be attributed to the changing taste of your breast milk. Your milk supply may also diminish, contributing to your child's refusal to breastfeed. On the other hand, you may be able to breastfeed throughout your pregnancy. Depending on how you feel and your milk supply, you may find yourself breastfeeding an older child and a newborn baby simultaneously. However, always give priority to the breastfeeding needs of the infant.